Thank you, Jim, Terry. Thanks to my wife for coming in here. Thank you all for this opportunity. It's really amazing, and what I'm really most impressed about is how healthy everybody looks on stage and in the audience. I mean, this is truly, for America, a big shock. I mean, you should all, really, I mean, I'm not being patronizing. I'm really telling you, I'm looking around and I'm seeing a lot of very healthy people. And I think that this is really the future for America, because I can guarantee you we will go broke treating illness. So the only option that all of us have really is wellness, and all of you epitomize it, and I really applaud you for it, because I know how hard it is. Now, you know, medicine for me has been, and my life in general has really been very privileged. Family, friends, and of course the study of medicine. And medicine for me has been an amazing journey. And it's really been sometimes an obstacle. You know, I'm constantly having to evolve and learn new information. Essentially, medical information turns over at about a rate of about 50% every 5 years. So every 5 years, I have to turn over how I'm thinking and how I'm advising people. And of course, the practice itself is evolving from a business point of view, and patient expectation levels are changing. I'm not competing with other physicians. I'm competing with a computer. I'm competing with WebMD and all of the resources that all the patients have, and that forces me to really be a better doctor and to learn on a constant basis. If I don't learn something every day, I'm falling behind. And that's really the challenge, hopefully, that for the physicians that you select at the same time, that their challenge is also to keep up. You know, this year for me has really been a fun and challenging year, as every year is. This year, we did launch a new book, and hopefully we'll have an opportunity to autograph some of them later on, No Guts, No Glory. I also am the spokesperson for a big men's health initiative called the Drive for Five, that tries to raise awareness in men that they need to be more proactive. I'm considering becoming the director of a major men's health, institution. So it really, for me, it's a constant challenge to grow, to learn, to provide for my family, to communicate information. And certainly, these kinds of talks are what really stimulates me to this challenge. It's kind of really interesting. When I first started studying medicine, it was all about illness. The word wellness, I don't think actually existed in the vocabulary of physicians. And certainly for me, the evolution from treating illness to preventing illness has been the single biggest change in my practice. And I think that for medical students right now, the word wellness is as important as the word pathology, which is really what we study as doctors: pathology, illness. Wellness now is going to replace that. How do we preserve the health and wellness of our population? And that really gets me to the heart of this talk a little bit, because it became very clear to me that 80% of illnesses can actually be prevented or delayed as a result of lifestyle changes. That's a big number, 80%, right? And when we have a country with a growing budget of illness that's going to make us go broke, this is a very important challenge and an initiative that really, I think is even more important than some of the healthcare policies that you're hearing about. You're not hearing enough about preventive strategies. Early diagnosis is not prevention. Prevention is the key. 80% can be prevented. The single greatest determinant of how healthy you are is the nutrient value of the foods you ingest and your body's ability to absorb those nutrients. So you can understand why I am excited about Mila. We're talking about an extremely nutrient-dense product that the body can absorb. But you're going to hear about that from other speakers, and you know already about the important and very positive value of Mila. But the reality is, it goes back to what I'm saying, which it is about the nutrient value of the foods you eat. And in this country, our form of malnutrition is obesity. I mean, we're talking about 50% of the population being significantly overweight to the point that it's not an issue of aesthetics. It's an issue of it's contributing to overwhelming disease in this country. You take obesity and you take smoking, you have the leading causes of illness and death in this country. And I think that what we really need to try to understand is how do we evolve a treatment, an approach to obesity that is very different from just telling people to eat less and exercise more. I mean, people who are overweight are not stupid. I mean, they totally understand that they need to eat less and exercise more. But there are factors that sabotage and contribute to their being overweight. So I thought that maybe we would talk a little bit about obesity and talk a little bit about how you need to change and evolve your thinking about this. And this is what, as a physician, I have to constantly do. And what I have to constantly do is to stop validating my own bias. You know, we all are looking for, validation. And in medicine, that's not a good thing. You need to be very open-minded. You need to be flexible. You need to be receptive to new ideas. And so the doctor who keeps, telling his patients who are overweight that it's a character flaw is not understanding the complex biology of obesity, all right? Let's see, do we have some slides? So the question is, why do otherwise intelligent people continue to gain weight, despite the knowledge, right? Why? And that's really a question that I've asked, for 20 years, because it's clearly, 40 to 50% of my patients who come in with hypertension, high blood pressure, sexual issues, diabetes, all have obesity as their main problem. And if I can simply help them lose 10% of their body weight, which still puts them in an overweight category, but less overweight to the point that it's not contributing to illness. Well, there are a lot of factors. Obviously there are environmental factors. Look at, go to a fast food restaurant and see what they do. Look at the supersizing of the burgers, of the Cokes, of the French fries, the Hershey bars. Look at the size that's evolved. We supersize everything. So that's one of the factors, right? But there are other factors as well. The body regulates weight very, very precisely. Let me give you an example. I'll have a patient who'll come to my office, let's say 4 years ago, and they'll weigh 238 pounds. Let's say they're 5'8" and they're 238. They're quite overweight, right? They come back 4 years later and they weigh exactly the same, 238 pounds. That's pretty amazing. 1 pound is about 3,500 calories. How did this person regulate their diet so that there was not even a 3,500 calorie difference over 4 years? Obviously, they didn't do it purposefully. There was some kind of regulatory center in their brain that was adjusting diet, food, satiety, metabolism, physical activity. So it's more than just how many calories you take in. There are factors that we have to understand better, and those are some of the factors that you see on the slide. There are signals from your small intestine, from your stomach, from your liver, that are constantly working with your brain, whether it's simply in the hypothalamus or other areas. But there is this extremely tight regulatory control. The idea is you could tell people who are overweight to eat less, and they will successfully do that, right? Every overweight person has lost weight, and they've lost a lot of weight. So obesity is really, and the disease is not characterized by an inability to lose weight. They do so amazingly well. It's characterized by an inability to prevent weight gain, okay? And so when they lose weight, after a while, for a variety of reasons, I think primarily chaos in their lives and certain genetic factors, they regain their weight. So if we want to deal with this epidemic, we're going to have a better understanding and a greater sensitivity to why people are overweight, both from an environmental and societal reasons, as well as from a biologic reasons. And then we can evolve into a solution. And if we manage to control this, we're going to have so much money left over in our health care that we can actually devote it towards primary prevention. And then all of those poor people who need transplants or who need sophisticated care will be able to afford it easily, as opposed to wasting money on diseases that could have been prevented to begin with. And that kind of leads a little bit to the men's story. You know, men are dying of diseases they need not be dying of. Look at this audience. Most of the people here are women, and look how great the women look in this audience. The guys are basically looking pretty slothful. You know, they are, not here, of course. Here they actually look quite well. We're talking about in general. Other companies, right? Not here, not Lifemax, of course. You know, I mean, we did a study, it's called the Drive for Five, and it's in connection with the Men's Health Network and Abbott. And 63% of men said that they would wait until they were in severe pain before they'd even consider going to the doctor. They actually think that wellness is the absence of illness, as does the medical profession, by the way. And that's a key point. You weren't well a day before somebody tells you you had have heart disease or diabetes, okay? Those seeds were planted a long time ago. Men will wait until their arms will fall off before they will consider going to the doctor. And believe it or not, 46% of the men in the survey actually said that they were scared to go to the doctor. Well, what are they scared about? I mean, it's not the prostate exam. I mean, come on, it's not that bad, right? It's that they don't want to be told to change their lives. They don't want to be told, don't do this or don't do that. Men don't react well in that setting. And I think that we in the medical profession need to change. We need to move away from being repairmen for men and become coaches. Men love to go to coaches, right? If Michael Jordan needs a coach, and Alex Rodriguez really needs a coach, okay, then I think that if we evolve that relationship and make it more even and more balanced, and we encourage men, to go to the doctor with the understanding that they will be somehow enhanced and improved, I think we can really change this. And that's why I'm really very excited. I'm actually doing this initiative with Terry Labonte, one of the big NASCAR drivers, right? And we go around the United States and we try to raise awareness, and I think it's been really very, very successful. And of course, if I do take on this position as a men's health director, it'll give me another opportunity to raise the level of healthcare for at least 50% of our population. But that's a little bit of a digression that I apologize for. So why is obesity so dangerous? Well, we know, for example, that obesity is certainly linked with heart disease and strokes and cancer and things like that. The question is why? And what happens is obesity results in fat cells which become larger and larger, and they kind of explode. You can't hear them because nobody hears fat, but if you were in another audience, if you really had great hair, you could hear these fat cells explode, releasing a whole host of unbelievably toxic substances that make your blood coagulate, that cause inflammation. Really, it's almost like that British petroleum disaster where the oil was spilling into the water and polluting the water. Well, your fat cells, when they explode, release substances that are polluting your body, okay? You got to cap those fat cells. Really, I mean, that's the image that I have. I try to transmit this image to the patients, and some of them never come back to see me again, okay? My wife thinks that I'm insulting when I told a woman that I didn't want any woman to weigh more than I do, So, so that number is about 190, all right? So, I mean, this poor woman was 5'2", she weighed 220 pounds, and every organ system in her body was collapsing. And it was just so frustrating to me when, she stood on the scale, and then I said, let me step on the scale, okay? And I said, we have a problem. I'm not blaming you, okay? But we have to recognize that I can't just give you an arthritis medicine, a diabetes medicine, a cholesterol medicine. I'm not going to help you. I'm not going to change the course of your life by doing this. I don't think she ever saw me again, but that's okay. At least, hopefully I affected her thinking somewhat, okay? So what happens is obesity and fat cells release these substances which are called, from a medical point of view, adipokines. And adipokines are a whole host of messengers that travel throughout the body and promote inflammation or coagulation or basically cancer promoting. And that's why people who are significantly overweight are at risk for all of those diseases, okay? And if you can see here, certainly it's associated with an area that men are very interested in, which is really a low testosterone and sexual dysfunction. And if you want to convince a man to take better care of themselves, and that's what we really wrote about in the hardness factor, it was basically we made the link between heart disease and sexual function. So if you want to be a stud, you've got to be healthy. I mean, that's the message. And that, believe it or not, actually has changed a lot of people's minds, about taking good care of themselves. So, from a purely medical point of view, when these fat cells start to grow, they grow all over, and it's essentially fat that's in your gut. That's being stored in your liver, more than, by the way, around your butt. It's really your gut. That's where these toxic adipokines are being produced and are so dangerous to everybody. So that actually leads to the next area, which is really why I wrote No Guts, No Glory. I like to find concepts that are universal and that apply to wellness. And I think that although I love the heart and I love the brain, and of course the lungs are beautiful, beautiful physiology. Really the whole body is just absolutely amazing. That's why I decided to be an internist and really not subspecialized, because I liked every organ system, okay? And I said to myself, I think I've ignored the gut, and I think that the gut really turns out to be probably the central organ system that is truly involved with wellness. And if we ignore the gut, we're going to absolutely pay a big price. And if we treat our guts well, then we have a great chance of being well. And that's why I kind of focused on a very simple idea. First, I defined what the gut is. And the reason I had to is because every single person who comes into my office, when I ask them what's bothering you, and they tell me my stomach hurts, and they're pointing to the right lower quadrant or the left lower quadrant, it has nothing to do with their stomach. It's the abdomen, okay? And the abdomen is filled with all of these organ systems, both hollow organ systems, your esophagus and your stomach and your intestine, right? But there are also solid organs, the liver and the pancreas. None of you ever think about your pancreas, right? You don't think about your liver, your main detoxifying agents, like having a dirty filter in your air conditioner. Do you think the air conditioner is going to work? Well, what we're doing to the liver is just unbelievable. We're force feeding like we do these poor ducks for foie gras. If you saw the amount of fat in the liver, you'd be, horrified. Now, I'm not trying to turn your stomach or anything, but I'm just telling you, you better start taking care of your liver. And of course, your pancreas, the insulin and all of the enzymes that are involved with digestion. And then, if the gut weren't important enough for absorption of nutrients, right? How healthy could you be? Even you could take all the Mila in the world, but if your gut's not working and you're not absorbing this, it's not going to serve you well. So not only do you want to pick foods that have nutrient value, but they have to be digestible. You overcook them, they can't be digested. And that's why we talk a little bit about enzymes and about being kind and nice to your gut. So the gut involves, I said, the hollow organs, your stomach and small intestine, your large colon. The large colon is more than just a storage. It has trillions of bacteria. And these trillions of bacteria are just not hanging around doing nothing. They are actually vitally important in metabolism and in immunity and in metabolism of medications. And we are not only ignoring these bacteria, we are destroying them like we do the Amazon forest. We're not feeding these poor bacteria, and what we are feeding them are injurious to their wellness. We're giving them antibiotics for viral illness. It's really pathetic what this huge organ system called your microbiota, which are really all of these bacteria that are living in your gut, what we're doing to them. We need to restore them to health and wellness. And by the way, foods such as Mila are very positive, have a very positive effect on the nutrient value of what you're ingesting. And of course, they're very healthy for these bacteria. So I think that you've got to look at the gut, and we did in our book, and we said basically take good care of your gut, and not only will you be well, but you will be really well. And then all of a sudden it became very clear that the gut does more than it's just more than involved with digestion, if that were not enough. Turns out that about 70% of the gut is also housing our immune system and immune regulatory cells. And immune regulatory cells translate into regulation of inflammation. So all of a sudden your arthritis gets better, your psoriasis gets better, your eczema gets better. And it's even conceivable that your thinking and mood will be changed. And we know there are so many children who are diagnosed with autism today for a variety of reasons that are really very complex. And many of these kids have digestive disorders. And whether it is primarily a gut problem or secondarily a gut problem, there is no question that changing the nutrient value of the foods will have a positive effect. And so I think that we're starting to see that the body has no walls, and that each organ system has an effect outside of the place that it's housed. And so the gut is really playing an influence in what we call extra-intestinal matters. As opposed to just being involved with things that are directly related to your intestines, it's affecting your brain, it's affecting your heart, it's affecting your muscles. And it's really the reason that we wrote the book, No Guts, No Glory. It's not complicated. And I think that, the 100 million people who suffer from a whole host of gastrointestinal disorders, they read this book and they make some very simple changes in their diet, maybe eliminating or reducing milk, eliminating or reducing dramatically gluten, adding foods that are digestible, taking some digestive enzymes and taking some probiotics. It's not that complicated. You don't need the purple pill, for gut health. You need to make some changes, and you are in control. It's the one organ system that you can control more than any other. I mean, you can't necessarily control the air that you breathe, okay? But you can certainly control what you actually put into your mouth. And I think that as you start to appreciate, the number of people who have maldigestion, how unpleasant it is, okay, and how it contributes to illness, I think we're going to get people to start to make some changes. The number of people who have food intolerance, fructose malabsorption, gluten, milk, okay, besides people who are allergic to a whole bunch of things, okay, so many more are intolerant of things. So I think I want to follow today, I used to follow Hippocrates a lot, but I'm tired of him a little bit, but I like Maimonides. My wife said, how come you're always quoting Hippocrates? Well, I had to take the Hippocratic Oath, but I don't understand why nobody in the medical profession follows this principle. Let food be thy medicine. How many doctors do you go to who sell you food, right? All right. So, but he says, let nothing which can be treated by diet be treated by other means. And I really think that that's absolutely the case. So when I told this poor lady who was 5'3" and 230 pounds with arthritis that she needed to increase the amount of omega-3s in her diet, maybe some vitamin D would be helpful, some probiotic enzymes, but she said, no, I want Lipitor, and I want Nexium, and I want, the Celebrex, and I need insulin. I'm going, just think about it. You have insulin, Crestor, Lipitor, and for guys, Viagra on this side, and you have fruits and vegetables and meal on this side. Which choice would you take, right? So I think that these are just some simple guidelines that you get in the book. It's not that complicated. Why don't, when you have a meal, why don't you sit down and maybe chew your food as opposed to running? I mean, does that make, I know that's very complicated. Maybe eating slowly. I mean, one of the advantages of eating an apple is it takes a long time to eat it, right? It's not that, eat with your kids, cook a little bit more at home. Kiki, cook a little more at home, right? No, that's not true. She would be willing to. I'm the one who's always asking her to go out. Here's another simple thing. Try to eat as much and as often as you can between 7 in the morning and 7 at night, and less after 7. That's not always practical because we all have social lives. But if you can eat more often between 7 in the morning and 7 without skipping meals, you're going to be thinner. How do I know that? I just do. I just know it. But here's okay, I'll give you a little bit of proof, but I'll give you proof in mice, all right? So they have these mice that are genetically identical, all right? And half of the mice they fed at the time that mice are supposed to eat, all right? and the other half they fed the exact number of calories, but at odd hours. After 100 days, the mice that ate food at odd hours had about 30 to 40% more body fat. Same number of calories, ate at a different time, explaining the biology of obesity, the circadian rhythm of hormones, and how it contributes to metabolism and fat deposition. So it's not just about the calories, although they're important, it's how and what and when you eat. And that's why I say try to eat often, don't skip any meals. And the problem is, thin people never skip meals, right? Overweight people always skip. They somehow think that if they don't eat breakfast, that somehow they're going to start their day thinner. No, just the opposite. Eat breakfast. Have a gluten-free fiber cereal with rice milk and some blueberries. That's a good way to start breakfast, right? Lunchtime, a little turkey or tuna or beans, and right? That's what everybody here knows what to do. It's not that complicated, right? Why do you need to go to a nutritionist to be told to have a gluten-free fiber cereal with some rice milk, right? I mean, that's what I would do. In any case, yeah, of course, tell people to avoid pesticides. That's a good idea. I mean, the foods today contain what we call endocrine disruptors. The substances that are in foods that are causing our endocrine system to change. That's why it affects testosterone. That's why it affects premature menopause. That's why it's partially responsible for some of the infertility issues. They're called endocrine disruptors, and they're environmental and food factors. So with this, I think I've spoken enough. I really want to thank all of you, Sherry, Jim, and all of you at Lifemax for really contributing to the overall wellness of this country, and we are all, really in debt to all of you. Thank you so much.